Welcome back to my YouTube channel. Yeah. It's been a while, so sorry about that. I've been very busy with a lot of things, and it's not really easy. So today we'll be talking about hepatitis, and hepatitis has been one of the major global health challenges. So before I moved in, as we all used to do, back to back. So if you're a new subscriber, thank you for clicking this video, but make sure you comment, subscribe, share this video. It's very important. If you're a subscriber, thank you for watching back again. Thank you for coming back. I really love you so much. As you all know, this my channel is about vlog, my lifestyle, and welcome back. So welcome back. So I'm very sure this video will be so helpful, so do well and give this video a thumbs up so it doesn't cost you anything. So let's go right into the video. Like I said, hepatitis, I'm very sure we've been very familiar with hepatitis, and we also know that we have different kind of hepatitis. We have the A, B, C, and others that we are familiar with. And today I'm just going to give it a brief, like a general, because hepatitis has been one of the major health challenges in Nigeria, African, generally in the world. So it's a viral infection that attack the liver and that caused both acute and chronic disease. This virus is commonly transferred from mother to child during birth and delivery in early childhood, as well as through contact with blood and fluids, during sex, unsafe injection, and exposure to sharp instruments, like I said. So WHO estimates hepatitis as 296 million with hepatitis V virus and 5 million with new infection every year. So in 2019, hepatitis B resulted in 820,000 deaths and mostly cirrhosis, that's very, very deadly, and liver cancer. It can be prevented through vaccine, like I said. Just a brief introduction to hepatitis. I'm very sure we guys are familiar with hepatitis, and just a brief introduction with how the the population census of people living with hepatitis and people at risk and everything. So that's why I have to give a brief introduction about hepatitis. So now let's go to the transmission. How is hepatitis vaccine transmitted? So in endemic areas, hepatitis B is commonly from mother to child, that's at birth. It's also called prenatal transmission. We also have another mode of transmission. We call that one horizontal transmission. So the horizontal transmission is through infected blood to an unaffected child during the 5 years of life. So it can also be spread through needle, like I said in introduction. Don't forget, through a needle, sharing of needle. Like normally, maybe you visit the hospital and it's quite crazy. The health provider is not accurate enough, or it's actually not really perfect. I can't really say perfect, but just make sure you are very, very careful when you visit your health facility. So it can also be gotten through tattooing, people that used to draw tattoo on their body, piercing instruments, body fluids, saliva, vaginal secretion, seminal fluid, that's the semen, that's the sperm that we general name, and sharp objects. So the most prevalent is the sexual transmission, and everybody wants to have fun, everybody wants to have sex. So but very sure, like in my recent video I talked about HIV/AIDS. So we have to be very, very, very very, very careful when it comes to like sex, and everybody wants to have pleasure, but at the same time apply sense. So the virus can survive in your body 7 days, of course, but incubation period is within 30 to 18 days. So but it might be detected in your body within 30 to 60 days. So that is a mode of transmission. So now let's move to symptoms of hepatitis. So one of the most symptoms is most people do not experience any symptoms when newly infected, which is of the truth. Just like when you have malaria, sometimes it might be asymptomatic at first, but will be later detected. So one is yellowing of the skin and eye, that has jaundice. Is very most important. We check our skin lining, our eye, that's the ecteric site of the eye, very well, and we eat balanced diet, and also at the same time we visit our healthcare provider like once in a month. It's very important for that's a medical checkup. So another symptoms you might have is dark urine. So you might experience dark urine. Yeah, it's very most important that we take this very very serious. You might experience once you experience dark urine, please visit the hospital. Another thing you might experience is tiredness, nausea, vomiting, pain in the abdomen. So that's another symptoms you might have. People with severe chronic and hepatitis can lead to liver failure, which is very very deadly. Now we have been familiar with liver failure, and we used to like hear liver failure every time. So we need to be very very careful with hepatitis. As I said, it's one of the major global health problem challenges in the field of public health. So I'm very sure this video is helpful. Don't forget, like I said, give this video a thumbs up. So now let's move to diagnosis. So the diagnosis is very very important. So like I said, hepatitis, don't forget we are talking about hepatitis. So one of the diagnoses is lab tests can be used to distinguish between acute and chronic infection. Why physical examination, ultrasounds, fibroscan and can be performed to assure degree of liver fibrosis and monitor the progression of the liver disease. So those are the ways hepatitis can be diagnosed. So what are the prevention of hepatitis? So now moving to the prevention of hepatitis. Hepatitis can be prevented through vaccine. All babies should be vaccinated with hepatitis B during birth, then follow up with a booster dose after 4 weeks. So it's most important we get this vaccine during birth. So and the booster dose are not usually required for people who has like completed the first 3 doses. So once you've completed the first 3 doses in the first case, so you don't need the booster dose anymore, because it's only of 3 doses. You collect the first dose, the second dose and the third dose. So once you've completed your first, second and third dose during like your childhood stage, so you don't need the booster dose anymore, and can last longer for 20 years or more than, of even for life. Like once you complete the first, second and the third dose, so it can last longer in your body for more than 20 years or even for life. So another thing we need to do is mother to child can be prevented through taking of antivirals medicine to prevent transmission in addition to the vaccine. So mother to child can also be prevented, like I said, through antiviral medication. Then practice safe sex. So practicing safe sex is always very very important, because this aspect, it's not really funny. Everybody wants to have fun. Like I said, wants to have fun, use your brain. So using of condom and reduce your sexual partner. Some people have many sexual partners. Like we all said, hepatitis can be transmitted through body fluids, seminal fluid and vaginal fluids. So avoid sharing of needles, tattooing instruments. It's very important that we don't share anything that can damage us or something, or even damage our entire life. Needle is very very important. We don't even share that. I used to advise people to even get their comb anytime they want to visit their stylist. So wash and sanitize your hands when you come in contact with blood, especially people that work in the health sector. Make sure anytime you touch blood, contaminated surface,